The wordless too have words. They just aren't ones you can hear, but often these are words you can see. It'll be there in their eyes, in the posture, in finger movements, in the diseases that claim their bodies. I was recently at a gynecologist's clinic, and there was a patient who had just left before me, and she returned with her husband and her family with her. They had a doubt about a medicine on the prescription. The woman was completely silent throughout the 5 or 10 minutes that her family was talking to the doctor, and she kept looking down. And when they were leaving, the family turned and thanked the good doctor for her help. And the mother said, almost as if a parting dismissive statement, that I don't know why she is sick. She has so much of help. And this doctor looked that woman in the eye and she said something that I could feel the weight of myself. She said, your daughter had a premature birth. She's underweight and malnourished. She can barely walk straight. Whatever help you are giving, it definitely isn't the one she needs. This is Sonali Acharji, and you are listening to Health Wealth, a podcast that wants to help you understand and embrace all aspects of your well being. I always feel very good when I'm part of moments where a patient is empowered. When I see a flicker of confidence in the eyes of someone who is carrying the burden of illness and social misunderstandings, that is such an unhappy combination to be judged and shamed when you are unwell already. But it does happen. Till 2019, Momspresso, which is a motherhood app, they were conducting a survey to measure happiness amongst mums in India. And each year revealed more than half to be unsatisfied with the quality of their lives. There are other health surveys which are done in India, and they estimate that close to anywhere between 25% to 30% women experience depression after birth. A large proportion of new moms also face issues with breastfeeding, infections, body pain, loneliness, and exhaustion. Would all of them have someone to speak up for them? Possibly not. Because if you see the statistics from Kerala, which is the only state to have studied suicides amongst pregnant women, they found that while maternal mortality has dropped from 66 to 43 between 2010 to 2020, the number of suicides amongst pregnant women increased exponentially. It went from 2.6% to 18.6%. Other states don't break down the cause of maternal deaths, but we do know that Indian women make up 36% of all global suicides in the age group of 15 to 39 years, and that is usually the childbearing age period. Maternal health is a very broad subject. From pregnancy to birth to post pregnancy, a mother's body goes through so much. And gynecologists often tell me that they see that the world lives in extremes when it comes to maternal health. Either they are being pumped with ghee and karas, and all their autonomy is taken away and they're mollycoddled day in, day out, or they just have no choice. They are given no compassion, no empathy. They have to carry another human being, but also fulfill all the other roles of being a wife, daughter, daughter in law, and now employee as well. To find that balancing point between doing too much and doing too little about maternal health, I think one needs to have facts and a real, truthful, honest understanding of what is maternal health. What does a mom need during pregnancy? What are these mistakes that all of us are making that is seeing maternal diseases rise all around us? And what are the essential things that we should be doing to reduce chances of a mom falling very ill? To give us these answers, I have with me today Dr. Priya Patil. She is a gynecologist with Altius Hospitals in Bangalore. Hi, Dr. Priya.
Hi, hi. Very glad
Thank
to
you.
be here.
Thank you so much for coming. Thank you.
Thank you.
We did a podcast before on infertility, and that was looking at egg freezing and the choices available when it comes to IVF. But maternal health is something, I suppose the reason I didn't do it is, like I said, it's a very broad range of conditions. But, just starting off, if you could just explain, do we have any idea of what is maternal health in India today? Is there enough awareness of the variety of conditions and diseases that can influence a mom?
Maternal health, as you said, is such a broad spectrum, right? And most of us don't understand what actually is. Like,
Mhm.
it's not new topic to us that we see mothers and, somebody is giving birth or getting pregnant. It's not new, but what is less understood is we have not paying attention to the mother, but we pay attention to more of the, oh, she's pregnant, oh, she
Mhm.
gave a childbirth,
Yeah.
those events. So the woman is neglected and the idea is celebrated. If you understand what I
Yeah.
mean.
Yeah. That makes so much sense.
Yeah. So maternal
Yeah.
health is right from when you are trying to conceive, you become pregnant and you undergo a child birthing process. And then there is postnatal health, right?
Mm-hmm.
Post-birth.
Mm-hmm. Mm-hmm.
Post childbirth is the most neglected one because you don't celebrate the mother after the child comes as much as you were celebrating her when she gave
Yeah.
news of being pregnant. So it is just not physical health, but it also is mental health, and the
Mm-hmm.
awareness or the idea about it is less known, and
Mm-hmm.
people are not sensitized to it as much as it should be, is
Yeah.
what
Yeah.
I think.
I also think, when I was trying to find out about what are these conditions, how many women go through them, apart from postpartum depression, there's very little research done on what Indian moms are going through health wise post birth.
Yeah, because they don't come out, right? There is not, some houses have the opportunity and the resources probably to get help, but it is not identified early. And in, worst cases, there is no resources available. When you were talking about maternal mortality rate, right? We have
Mm-hmm.
shown a tremendous improvement in our maternal mortality rates. We are at 97 now when we were at 220, and there are certain states which are having maternal mortality rates as high as 200 as well, even now, when the overall cumulative is reduced. So this maternal mortality rate is just not people dying due to lack of infrastructure or help. It's about, as you said, suicides,
Suicides, yeah.
maternal suicides. It is not documented or it is not interpreted as much as it should be.
Mm-hmm.
So there is a lot of gap,
Mm-hmm.
what we see in these women, and the socio-economically deprived women are the most affected. Postpartum depression, when we talk about it now, it seems like a more of a social well-being problem, but it
Yeah.
isn't. It
Yeah.
Hormones don't decide whether this woman is rich or
Rich
poor.
or poor, yeah. Yeah.
So pregnancy itself is like a lot of change of hormones, where the woman is undergoing bodily changes and mental changes as well, as an effect of this progesterone and estrogen levels going here and there. And when she delivers, the complete shift happens from the mother to the child. Even you or me, when we go to
Mm-hmm.
meet a friend who is delivered or a relative who is delivered, the first thing you want to see is the baby, the
Yeah.
next the mother, and
Yeah.
everybody comes and sees the baby, and just plays around, and and go back, and she has to bear the brunt. She can't talk, she can't express herself, because we as a society have made her feel guilty about how she feels about herself. If
Mm-hmm.
she puts her needs in front of anybody else's, especially the baby, she's shamed for it.
Yeah.
And not only that, the mother also feels guilty, saying that am I more important than my child? And am I supposed to be doing this when I'm supposed to be taking care of the child? Or if she is
Mm-hmm.
going through, say, a breakdown, and she hears her child cry, what is she supposed to deal with, her
Yeah.
breakdown or the child, right? She and the attention shifts, and there are a lot of people all around telling her what to do. There is
Mm-hmm.
no freedom. She loses that freedom. If she wants to do something, there is a mother-in-law, mother, or some relative saying that नहीं कर वो नहीं करना, like, or
Yeah.
you
Yeah.
smart bardo, this is
Mm-hmm.
not what you're supposed to do as a new mother. So there's a lot of dictating thing, and as you said, she feels that her voice is curbed, and she has no place to express it.
I
And
agree.
I
Yeah.
think as doctors we should give opportunities to the mother when she comes, maybe send everybody out and only keep her in the room and talk to her.
Yeah. No, I have started noticing that a lot of gynecologists now are focusing on empowering their patients, and I think that's it. But I mean, sadly, it happens in urban areas, but it's something. You mentioned two hormones which are actually my enemies because they're always giving me trouble, estrogen and progesterone. Could you maybe walk us through the biology of what's happening to a mom, those invisible things that all of us can't see, that's giving all these problems, particularly the hormonal problems?
So, as you said, you have
Yeah.
experienced estrogen and progesterone hormones going here and there. See,
Unwillingly experienced it.
so what I would like to put it in a more simplified way. So, when you are undergoing premenstrual syndrome, where you experience bloating, where you experience mood swings and everything, that is when your progesterone levels are at a higher level than usual. Okay. So, imagine in pregnancy, these progesterone levels are almost 10 times, 15 times more than what your premenstrual, illy what you are facing. So,
Mhm.
pregnancy is a condition of sustained increase in progesterone so that your estrogen levels are a little low. So this progesterone is the one which relaxes everything, and it's extremely essential for the pregnancy to continue. So
Mhm.
when a woman imagines her premenstrual syndrome, how much of a trouble it is, a pregnant woman is undergoing like a 10 times trouble because of these hormones what are changes, and it is essential, as I said, to carry forward the pregnancy, and that is how nature has made us. So
Yeah.
progesterone levels are extremely high and increased in pregnancy as compared to a normal individual, where in a normal individual it is cyclical, like every
Mhm.
menses there is up and down, and in
Mhm.
pregnancy it is sustained increase of progesterone levels.
And what happens post delivery? When we say postpartum depression, are there certain conditions that create or lead to postpartum depression?
Postpartum depression, hormonal changes, as I said, is one of it, because when you're continuing your pregnancy there is a sustained high maintained, and suddenly after the childbirth there is difference in estrogen and progesterone levels. But
Mhm.
postpartum blues, there are other features also which can aggravate or have it. So imagine a person is already having anxiety issues or has had episodes of depression. This person is most likely to develop postpartum depression than her peers when compared.
Mhm.
So people who have less support from the family or partner, and when say preterm birth is again one of the triggers, because she's thinking a lot about how and what, and these are the few things which predispose the lady
Mm.
to have postpartum depression. And when I say postpartum depression, there is one entity which comes between postpartum depression and the normal postpartum, that is
Mhm.
postpartum blues, right?
Okay.
So this postpartum blues is something which is a little transient, and when paid adequate attention to it, we can get the woman out easily and then let her slip into postpartum depression, which
Okay.
requires more therapy when it comes to cognitive behavioral therapy, or when it comes to drugs,
Mhm.
treat her. So something which, see, having mood low here and there is a routine. It's a part of
Mhm.
our life, which is quite stressful as it is. when what are the signs which they have to recognize is persistent low mood,
Okay.
crying spells, not able to take care of herself, not able to take
Mm-hmm.
care of the baby as well, and irritability. So such are the few things you have to pick up. And when
Mm-hmm.
sit down and tell her it's okay, I'm here, I will take care of the baby for some time, why don't you get some rest or sleep, because the
Mm-hmm.
sleepless nights are real for mothers. It's a new thing for them,
Yeah. Yeah.
a new thing for every mother, not
Mm-hmm.
even just the first time mother, the second time mother as well, because the second time mother has another child to take care as well. And
I
every
agree.
pregnancy is different. So if you say that, oh, it's my second child, it's not that the same thing has happened to her again.
Mm-hmm. Mm-hmm.
So support, I think, is very, very, very important. It's a shared responsibility. It's a shared responsibility between people around her and us as a society to, create such an awareness and
Yeah.
tell others it's okay. And, doctors giving the right kind of support and a safe space for the mother to talk
Mm-hmm.
about her feelings.
So, can we predict postpartum depression or blues? I mean, you said there's certain factors that predispose you, but there's no diagnosis test, or like you can't really know for sure. You,
Not Yeah, you can't
mm,
know, there are no blood tests or tests as such,
yeah, yeah, got it.
identify it, or
So just symptomatic
about,
identification.
yeah, whether it is, if
Mhm.
one woman is at a more risk than the
Mm.
other, it's different.
Right. Right. So I know about postpartum depression because it's been getting quite a little bit more, internet mileage than other maternal health issues. So
Yeah.
one comes across it quite a bit. Are there other physical health issues which are very common in Indian women when they are pregnant?
Yes. Indian women, as per se, have very low iron stores,
Hmm.
less reserve, what we say. See, for your hemoglobin to be good, you need good iron stores. So, Indian women, as it is, have a little lesser iron stores comparative to the Westerners.
Hmm.
And when a woman gets pregnant, the
Hmm.
demand increases because she has to, supply the blood flow to the baby, and there is
Hmm.
hemodilution, thinning of blood, because the volume increases, so she needs. So anemia is one of the problems what we face in the Indian population, and it is more predominant if a lady is young, that is adolescent pregnancy, teenage
Hmm.
pregnancy, what we say, or repeated pregnancies where there's not a lot of gap between two childbirths, and nutritional, where we see in a socioeconomically poor class. So anemia is one thing that we commonly deal with in India. I think the government hospitals are, you check, I government hospitals won't see a hemoglobin more than 10, where the normal is
Gosh.
12. So as when we see, when I was doing my post graduation or
Mm.
anything, 10 is a good hemoglobin for us, because we have seen hemoglobin of 6, 7 who come
Right.
just like
Right.
that. So 10 is good, but see, we are getting our standards low, right? From
Mm-hmm.
12 we are coming to 10, saying that, oh, 10 is normal in Indian population. That should not happen.
Mm-hmm.
So anemia is one thing in
Right.
pregnancy, and we are also more predisposed to preeclampsia. Preeclampsia, what I say, is hypertension diseases in pregnancy, which gets worse. And these women can have seizures as well, that is fits in common words. And I have also noticed that diabetes is on the raise, the gestational
Yeah.
diabetes, what say, because lifestyle modifications, and lot of women who have PCOS
Mm.
are exposed to this kind of gestational diabetes and diabetes in their later life as well. So these
Right.
are the two things which we see in pregnancy. And
Mm-hmm.
infections, vaginal infections, candida, that is fungal infections in the vagina, that also we see very commonly. And when
Mm-hmm.
it comes to childbirth, postpartum hemorrhage, what we say, PPH,
Okay.
that is sudden loss of blood in the women after the childbirth. In normal deliveries, it can be more than 700 ml, and in cesarean births, it is more than 1 liter of blood. This
Mm-hmm.
is the most commonest reason for maternal mortality in peripheries.
Mm-hmm.
One, because there are delays in the treatment. First, probably the recognition itself that this woman needs help. Second is the delay in receiving help. Third is delay in receiving adequate help.
Mm-hmm.
So these are the reasons why these women succumb, because the blood loss in women is not
Mm-hmm.
the same in the normal women. The blood vessels are all dilated to give that kind of blood supply to the child. So
Mm-hmm.
once she delivers, she will lose blood in half an hour, whatever is
Okay.
there in her body, and she will
Yeah.
that will lead to shock. So recognition, and this recognition can happen when we have trained individuals. And even if we are using dyes, which were very commonly used
Mm-hmm.
before
Midwives. Yeah.
Yes,
Yeah.
midwives.
Mm-hmm.
Training, adequate
Mm-hmm.
training to these midwives, and having a peripheral healthcare centers which are strengthened with good healthcare professionals is
Yeah.
extremely necessary, and ambulance services to get her to the tertiary care.
Mm-hmm.
And it when you're sitting in a city, probably you won't know what is missing, but just that not availability of blood banks surrounding you, it is very, very important issue
Mm-hmm.
there,
Mm-hmm.
which we have to concentrate on. Government also is coming up with certain abhayans and schemes, but we
Mm-hmm.
should see how much it is getting implemented and how the resources are being
Yeah.
allocated and
Yeah. Yeah.
utilized the right way.
Yeah.
Other
And
problems can be
yeah.
infections in these women, uh, postpartum infections, wound infections, okay, no, the episiotomy, that is a cut which is made during the childbirth, that infection, again, leading to anemia. Then one more important thing is thromboembolism.
Mm-hmm.
Uh, we have seen that, blood clot in the arm, legs or something, sudden deaths in women. So this thromboembolism, that is deep vein thrombosis,
Mm-hmm.
is also one of the most dreaded complication in postpartum, which not many people would have
And why
heard of.
does it happen? Why would it happen?
That's because pregnancy itself,
Mm-hmm.
nature is so beautiful. I'll tell you, everything is made for a reason. So
Mm-hmm.
blood in these pregnant women is easily coagulable,
Mm-hmm.
because they know that she is going to give birth, and there is a mechanism that the blood should clot very easily than seen in a normal person.
Mm-hmm.
So when the lady is pregnant, and
Mm-hmm.
after that she delivers, there's hemoconcentration, and these
Mm-hmm.
blood clots collect in your legs when there is not good mobility and there is no adequate hydration. And previously she is already suffering from hypertension and diseases. The blood vessels in the calf might be of a big size, but once
Yeah.
when it goes to the pulmonary vessels or the heart, it blocks the
Mm-hmm.
vessel, and that causes embolism, that is causing the death of the patient, and it's
Mm-hmm.
sudden. It's
Yeah.
really scary. So these are the few things which are coming to my mind as of now, at least.
Yeah.
Postpartum people
Yeah.
suffer again
And
mental depression.
and you mentioned the need for support. Now I do believe that there is a lot of intention to support moms during pregnancy and after birth as well. But a lot of times, a lot of generational knowledge is implemented, those old wives' tales. I've always been curious and I wanted to hear from a medical professional whether there's any truth to this. So, can you tell me if these are true or not?
Okay.
If you eat a lot of ghee during pregnancy, then the baby comes out easily. Is that actually true?
No, I think ghee is only going to increase the calorie intake and give you a good amount
It
of.
doesn't slide the baby out. I thought that was wishful thinking myself, but I really wanted to confirm it.
No.
A lot of people do that. They give huge amounts of ghee to the mom and they say that the baby's going to come out much easily then.
But I would like to take this platform as an opportunity to tell people,
Mm.
the amount of things I see around on internet and think about this vaginal birth being most
Mhm.
clear. I mean, women don't have to be subjected to this, right? It is not, how the child was born. It is the process what we are supposed to pay more attention to.
But
You
they say if when the child is coming out of the birth canal, I mean that was also something I wanted to ask. There's a squeeze that's given to the head, and I believe that squeeze helps the brain develop. And if you don't have the squeeze, then you have neurodevelopmental disorders. Is that true?
This part is right. It's not to the brain. The
Right.
squeeze, it's known that, see, the babies in womb don't have their own respiration. So when the baby is coming through the vaginal canal, the secretions are squeezed out of the lung, and it
Mm-hmm.
helps the baby, breathe better. Is a thing. I'm
Mm-hmm.
not denying that. But would you rather have a baby who is crippled for life, or have a child born out of cesarean section? When such a question comes, would you, see, when I'm saying that no obstetrician will say I want to do cesarean directly, not because I want to not let you try
Mm-hmm.
for vaginal birth. It's not like that.
Right.
Cesarean deliveries, or when we study in books, it has its indications,
Mm-hmm.
right? So
Mm-hmm.
it is done only when it is indicated. Cesarean birth is not a substitute to vaginal birth. I am not saying
Right.
that.
Right.
Whenever a woman walks in, a pregnant woman, my first thought will be to see if she can deliver normally. But
Mm-hmm.
I am saying that obsession should go. That
Right.
obsession that I need a vaginal delivery should go.
Mm-hmm.
Whatever is more feasible, whatever is the less riskier way for the
Mm-hmm.
mother and child should be opted. Not everything.
Right.
And you can't
Right.
blame a lady saying that, oh, you didn't have a vaginal birth, is it? Oh, my
Yeah.
daughter
Yeah.
got a
Yeah.
vaginal birth. That is wrong, right?
Yeah. It becomes social currency
Yeah,
then. Mm.
that thing should go. You're not supposed to look down upon a woman because she's undergone a cesarean birth. Like that, twins is also not normal, no?
Yeah.
Don't
Yeah.
look upon twin delivery. Vaginal birth is the natural process. Uterus was made for one fetus. When two fetuses are born, do we look about, oh, what have you given birth to two people? It's not like that. You just have to
Right.
accept it as what I'm trying to say.
Right. And another thing
And
which I've often heard, I just wanted you to tell me if that's also true or not, is that if you eat a lot of meat, then your
Hmm.
baby becomes very temperamental. Is there any relation between eating meat and the temperament of your child?
I no, I don't think so.
And when you're breastfeeding, a lot of there are stories of giving easily digestible food
Hmm.
to the mother, because I believe then that helps the baby digest the milk better. Is there any relationship with that?
No, breastfeeding women should not limit or avoid any kind of food for that matter. What
Hmm.
we only advise is take the nutritious diet, because
Right.
she needs
Right.
it more, and drink plenty of fluids, because that
Right.
helps milk secretions. And
Yeah.
avoid certain things, because some of the thing what you consume are
Hmm.
secreted in the breast milk that can be
Hmm.
harmful for the baby. And
Right.
these are the only things, but otherwise it's not that you keep giving her liquid meal, the baby
Yeah.
is better. It's not
No,
like.
because a lot of times I do, you come across the mother help groups online, the maternal support groups, and these are like very frequently uh, talked about things that, other mothers are advising, and moms are eating all sorts of things, all sorts of herbs and teas and this and that, which is fine. I
There
mean,
are
you
no, there are some products which help you secrete more milk than other
Mhm.
ones. I also, believe in that, and there is evidence-based trials also on certain foods, which is
Right.
acting as a milk secretion. That is called a
Mhm.
galactose. But that doesn't mean that whatever way you're eating, it is, it's not that you eat simply digestible foods the baby is going to digest. That doesn't work like that.
Right. So, what would be ideal nutrition for a mom during pregnancy, and again for a mom after childbirth?
It's basically nutritious diet. In pregnancy, there are adequate so when you're
So you'll
pregnant.
have to say what is nutritious, because that's widely debated. Like if
So
you could give a few food groups or
yeah, I
things which are important. Yeah.
So when I say nutritious diet, it is
Mhm.
a good balance of high quality carbohydrates in way of whole grains. So when you say that rice, when you compare rice and when you compare oats, and these are
Mhm.
all belonging to the carbohydrate group.
Mhm.
So I would prefer the pregnant woman to eat whole wheat and oats more than rice, just rice. But I'm not saying they should cut down rice on the whole.
Mhm.
Just about the choice of carbohydrates, and your plate should look very colorful. You eat a good amount of green leafy vegetables, you eat
Mhm.
good fruits, and protein, you inculcate one or the other way to have consume protein in your meal. It
Mhm.
can be red beans, it can be vegetarian dal, or it can be non-vegetarian meat. I would ask the pregnant women to avoid red meat. It is not very good for the
Right.
body. Not otherwise also, but
Mhm.
they can consume, chicken. They can consume egg whites. So it should be a balance, and drink
Mhm.
plenty of water. So
Mhm.
this is what a nutritious diet looks like. And
Right.
avoid processed food, fried items, oil,
Mhm.
eating out, which especially all this Chinese food has some amount of MSG.
MSG.
So
Yes.
you
Yes.
avoid that.
Mm.
Otherwise, there's no particular diet as such. A
Mhm.
woman gains 9 to 11 kgs during her pregnancy, and that is adequate weight gain. In the first 3 months, she loses weight. That is
Mhm.
very, very normal and physiological. So
Mhm.
after that, she starts gaining weight. So 9 to 11 kgs is adequate. Too little weight gain and too much
Mhm.
of a weight gain
Mhm.
is also a problem. Too much of a
Why would too much of a weight gain be a problem?
again, when I say, when I tell you too much of a weight gain, it is a predisposing factor for hypertension again,
Mm.
diabetes again.
Diabetes. Yeah. Yeah.
Yes, and more of hypertension than diabetes, to be
Mm.
said that.
Are you
So
seeing more women in, say, an urban city like Bangalore? Do you see more women coming with extra weight gain now? Because, we are also exposed to so much of processed and ultra processed food.
no, I wouldn't want to call it as a specifically urban crowd. It's not like
Mm-hmm.
that. There are
Okay.
some women who don't gain that much weight.
Mm.
More concern is the ones who have less weight gain.
Less weight gain. All
People
right.
come and then the relatives say she's not eating in the first trimester because the lady is having aversion to food. She's feeling nauseous. She
Mm.
can't eat. So
Mm-hmm.
the patient comes and complains, the patient party, she's not eating.
Mm-hmm.
They're, I think they're less bothered about the patient, and they're more bothered about the nutrition
Mm-hmm.
going to the baby. And it is a
Mm-hmm.
sad thing. So
Mm-hmm.
she's not eating. I'm getting her so many things, and she's not because she is not feeling like eating. So first 3 months, mothers, eat what you like,
Mm-hmm.
avoid what you feel nauseous about. That is my dictum.
Yeah.
It
Yeah.
is nothing that if you don't like it, don't eat it. Don't punish yourself thinking
Mm-hmm.
that somebody has told I have to eat it to feel better and make my baby better. Don't do that to yourself.
Yeah. Yeah.
Something absurd I heard from my friends. They said there are certain places in the country
Mm.
where if they get to know that if it is a male baby, then they feed the mother with badam kesar, no matter how poor they are. And if they
If it's a
realize
female.
that if it is a female and then she is deprived of the food, see, the discrimination has still not gone. And with so much of rules and so much of women empowerment, it is sad state still. It is heart wrenching that people still somehow find a way to abort their female child, and
Yeah.
it's very, very scarring to women especially. You
Yeah.
imagine if that were to happen to you, and the you are blamed. And not many people know this, but the male is responsible for the sex of the baby.
Mm-hmm. Mm-hmm.
Women have X chromosome, so
Yeah.
she does not decide. An egg has an X chromosome. It
Mm-hmm.
is the sperm which has an X chromosome or a Y chromosome,
Mm-hmm.
and whichever fertilizes will result into a boy or a girl. So it's
Yeah.
the male, guys.
Mm.
It has to end, blaming the women for not
I
giving birth
agree.
to a male child.
Yeah. In fact, I once met a woman who, and this is not even in rural India, this is in Bombay, in a very,
Yeah.
very upper class family who managed to fly her out and get the sex determination done. And there was an abortion done. And when she finally did conceive a male child, the emotional trauma of what she had gone through, which wasn't addressed because they just assumed we're doing it for your well being, you're going to have a son. So when she came back and then she went through that emotional trauma, she had such severe postpartum depression that she couldn't be around the boy at all. She couldn't even go near him. For almost years and years, it was her mother and her mother in law who, had to do all the child rearing. And that boy has grown up also scarred because he's constantly seen his mom having these fits and emotional outbursts. So it's not just that, you get your way and you've figured out that the child is a boy or a girl, and then you've aborted and you've figured out how to get a male child. The journey that you're putting that mom through is also going to impact your child. Even if you end up having a male grandson, um, think about what that baby is going to go through, knowing what his mom has gone through.
It's just that set of affairs, as I told. They
Mm-hmm.
don't think. I told you, the maternal health, talking about the subject itself is so important because, as I said, it is not about the mother anymore. It's only about the pregnancy, and it's the the outcome that is a baby. And that's
Mm-hmm.
why we Indians neglect our mothers, and that
Yeah.
needs to
Yeah.
stop. And it really
Are
does.
there a few things in terms of exercises? Because I do know a lot of my friends have said that when they've done yoga, for example, it's helped the overall pregnancy, it's helped manage emotions as well. They met other moms in these classes. So there's been that sort of emotional stability because of exercise. Would you recommend exercise during pregnancy and again post childbirth?
Exercising in pregnancy and postpartum is not contraindicated. It is a good thing that women are indulging themselves in yoga, aerobics. Any light or moderate intensity workouts are actually encouraged, because there are no trials which say that exercise leads to abortion or preterm births or in preterm labor, as such. But you need to consult your gynecologist or obstetrician before you start, because
Mm-hmm.
every pregnant lady doesn't have the same conditions. There are certain conditions which would I would want to restrict my patients. Say if the placenta is below, that is
Mm-hmm.
near the cervix, that is called
Right.
placenta previa. In such cases, or you have had history of preterm labors due to cervical incompetence, that is your cervical tissue is slightly lax and weak to hold the
Mm-hmm.
pregnancy, and you are diagnosed with hypertension. In such women, I would ask them to take exercise a little bit moderately low, because they can do yoga, but I wouldn't advise them to moderate intensity workouts or aerobics as such.
Mm-hmm. Mm-hmm.
So, postpartum, after cesarean delivery, the lady can resume back to strength core
Mm-hmm.
exercises as earliest as 6 weeks.
Mm-hmm.
And if the lady has delivered, through vagina and naturally, as one likes to say it, then she can resume to exercise, normal exercise in 2 through 3 days. But when again it comes to strength core, I would also advise them to wait for 6 weeks and resume it.
Yeah.
helps them strengthen the abdominal core. It'll help them lose the weight they have gained in the pregnancy, and also, take good care of themselves. It's like
Mhm.
a break, from, and it feels like they're getting back into their routine.
Yeah,
It's a good thing. It's
yeah,
definitely encouraged when the situation is right.
yeah. No, I agree that when I started off, the reason I said maternal health is such a broad subject. We can't obviously cover all aspects of it, but thank you very much for everything that you've shared. It's a good starting point, and certainly, when you hear a doctor say that, let mums look after themselves, look after the mom, don't just look at the child, look at the mom. I think it does drive home a message. So thank you very much for everything you shared. Thank you.
Thank you. And it helps sensitize a lot of people there.
Mhm.
And to sum it up, I also would like to add that I think the paternal, responsibilities and duties also, the fathers need to
Yeah.
step up. And even at workplace, I think, something recently I heard which stuck with me. It
Mhm.
said that, maternal leaves when, the lady goes to the pregnancy and breaks through her work, and it sets her a little, it gives her step back in her career
In a
growth,
career. It
whereas
does.
males, as a virtue of their physiology, don't have to have that setback. If you normalize paternal leave, I think that equalizes the maternal and paternal absence at work, and gives us also equal opportunity to get our careers back in the line.
Yeah, yeah. No, it says that once a woman gives birth, her career graph actually starts to dip, and it takes her 20 years to catch
Yes.
up to where the man has gone. So, it's there in the data as well. It's been much researched. And
We
anyways, I have these friends whose husbands do help out, and they do change diapers, and they do, help feed babies. But, then one also has to say that at the end of the day, they're also not facing progesterone and estrogen. So, even though it's difficult for them to
appreciated.
do it, it's doubly difficult for the mom to do all the work.
Yes, but they're appreciated, no, for it. A mother
Ye-
is not appreciated for
No,
changing the.
because that's her job.
It's changing, and I like
It
it.
is.
It's
Yes.
lot of places, when lot of places where the mother has given birth, the lady's mother used to stay with them overnight, and
Hmm.
it's changing to their husband staying, and
Yeah,
I frankly like it a lot, and
I
I do
like it a lot too. Yeah.
support the idea, and
Yeah.
I hope that is the new change.
Yes. Great. Thank you so much. Thank you.
Thank you. Thank you.
I think one should celebrate real motherhood and not the ideal one, where moms are just superhuman, available all the time to nurture everyone, and a product of what everyone else is telling her to do. The ideal mom is actually one who at 50 will look around and look at her condition and go through the impact, the emotional and the physical impact of not having looked after herself. The real mom is one who can say no, who can take out time for herself, who doesn't have to do every single thing that other mothers did, who is allowed to make mistakes and be human and deserves to be loved, not because she's perfect, but because she's just a mom. And that by itself should be enough. One shouldn't have to check all these boxes just to get a Mother's Day card. Health, particularly maternal health, to me is a result of what you expect and what you accept from a mother. Should mothers be allowed to make mistakes? And what, according to you, is the best way to support a new mother? Do share your thoughts and experiences. You can write to us at pods@indiatoday.com, or you can message us on 8588 966 996. You can also get in touch through Facebook, WhatsApp, X, and Instagram.